Pompe disease is rare genetic disorder. It's important because it's highly fatal, especially for kids in the first year of their life. Pompe disease causes muscle weakness. That's most important characteristic of this disorder. It is called atrophy. You can see here is normal part of the body and second part is atrophic. So it causes muscle weakness and atrophy. Now let's say how this disease is developed and what's important. We have alpha-glucosidase, its enzyme, and normally when we eat food, especially when we eat carbohydrates, we get glucose from it. This glucose is converted, some part of glucose is converted to glycogen, and when our body needs glycogen, it is converted back to glucose again, and after this glucose is burned as an energy and we get energy. And most important part here is glycogen should be break down to glucose again in lysosomes, and this alpha-glucosidase is a ferment or is an enzyme which is needed for breakdown of glycogen. And if we have faulty or deficiency of alpha-glucosidase, then it causes deposition of glycogen into lysosomes. That's important. And this glycogen damages lysosomes first, then damages cells and damages muscles predominantly. That's why it causes muscle weakness. So this damage of muscles is most important part here, and it causes symptoms. And we have two important type of this disease. First is infantile-onset Pompe disease, and second is late-onset Pompe disease. Infantile form is highly fatal. It's highly fatal, especially first year of the kid's life. It's highly fatal, and it causes muscle weakness, feeble cry, and difficulty in feeding, enlarged heart, cardiomegaly, rounded bell-shaped body, protruding abdomen, and thin small limbs. That's why it has bell shape. So muscle weakness, feeble cry, difficulty in feeding, and enlarged heart can be signs to suspect for Pompe disease. The symptoms occurs within first year of life of their life, and in case of late onset Pompe disease, symptoms can develop anytime after, since childhood to adulthood, anytime literally can these symptoms develop. Symptoms can be more severe or less severe, and generally it's less severe and progress slowly. Muscle weakness still important symptom here, and it's people say that they difficulty climbing stairs, rising from a seated position, carrying difficulty to carrying heavy object, and such symptoms are common. Fatigue and shortness of breath also important, because for breathing we need also muscles, and muscle weakness causing breathing difficulty, especially if person is lying down on flat surface. And heart enlargement and heart failure is also symptom. And when we saying about heart failure is also the most common cause of death in case of Pompe disease in infantile form. Or so children, kids, young kids before age 1 frequently die because of heart failure, because heart also muscle, and muscle weakness causes progressive heart failure, of course. Now let's say how we diagnose this disorder. For diagnostic criteria are alpha-glucosidase enzyme activity, and gold standard of diagnosis is genetic test identifying mutations in the GAA gene. That's gold standard of diagnosis. And treatment is enzyme replacement therapy, but this therapy has many limitations. First limitation is it can't reverse already damaged tissues. Second major limitation is that it cannot stop disease progression totally, so partially can stop or slow down this disease progression, but not 100%. This second. And third is immune system can attack this enzyme replacement therapy, or it's genetically modified enzymes, and our immune system can attack it, and its resistance towards treatment. That's main limitations of treatment, but in many cases it extends lifespan importantly. Even in case of infantile-onset Pompe disease, there are many cases described that these children which should be dead in first year of their life, they live more than teenage. So this treatment is not panacea, or is not very effective, but still important to increase patient lifespan. That's all I wanted to say. It's a rare disease. Pompe disease is autosomal recessive disorder, means it affects males and females equally, and it affects one person in 40,000. It's a rare disease, but still important because it has high fatality. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.